I'm Chris Rogers. Nice to meet you. I'm the founder of San Diego Orthobiologics and medical director for personalized stem cells. I am joined today by my long-term friend and really mentor, Dr. Bob Harman. Hello, Bob. And I'll let you give them your background. But Bob is, he won't say this, but he is a pioneer in stem cell research, stem cell clinical translation in veterinary medicine. And so we're going to hear about some of the work that he's done there. And we hope to translate this technology soon to humans. Actually, we are already doing that. Now, I have to share my screen if that's working. And we'll start at the top. Can we see the first slide?
Absolutely.
Excellent. Well, again, I'm Chris Rogers, we'll be joined later by Dr. Evangelista, my colleague, and then we have Dr. Robert Harman. So we're going to talk about the future of stem cell therapy. We've been hearing about stem cells for, gosh, feels like 3 decades, but it's here, guys. It's here. So let's talk about it. Briefly, we're going to talk about the current state of the industry, the basics that we think you should understand about some of the stem cell science. Don't worry. If you have a high school degree, that's enough to understand the science that we're going to present. We're going to share with you the concept that dogs don't lie. They tell the truth. We're going to talk about how the science then becomes translated into the clinic and how it can be used as a treatment using your very own stem cells. Yes, your stem cells are the best. And there are some early access programs we'll talk about, as well as our vision for the future. So I'm going to turn the floor over to Dr. Harman.
Great. So I am a veterinarian by training, but I spent the last 35 years developing human and veterinary drugs, and 20 years ago started with development of cell therapy. I'm a statistician by training and a data person, so you will find I sprinkle data in. I'm evidence driven, as Dr. Rogers often says about this. We want evidence for being able to get treated, and you will notice if you look at all of these kinds of billboards and signs and advertisements, the stem cell clinics that are illegal have been much hyped. They lack scientific support and evidence, and they really are truly illegal and dangerous, many of them. Locally here in San Diego, we had a group of patients get treated by one of these clinics and get intravenous E. coli. Not particularly good to get bacterial infusion into your body thinking you were getting stem cells. So it's really quite a mess. So aging, we think, is one-way street. Maybe? Chris, click the next one. The real question is it truly one way, or do we have a possibility to slow this down? Do we have a possibility to make aging a more gentle process and a slower process and have longevity without being in one of those walkers or wheelchairs? That's the real question, and we're going to address that today. So everybody has probably seen on 60 Minutes or 2020 or one of the TV shows a lot of hype about what stem cells are. Now with social media and the internet and YouTube, there's a proliferation. But this is really, really quite simple. These stem cells that we're talking about are your own healing cells. That's a beautiful picture from a colleague on those little pink stem cells are wrapped around a blood vessel. Every place in the body where there are blood vessels, which is everywhere, these cells are there and they're waiting for an injury, a disease, a bacteria, a virus, something that triggers them to activate. So this really has been nearly 3 decades, Dr. Rogers. Jimmy Thompson was the guy who really first put embryonic stem cells on the map. By the way, he was a veterinarian. And Dr. Arnie Kaplan, one of our close friends who passed away just this last year, really was the leader in looking at adult stem cells. So we're no longer arguing about killing babies and embryos and using those cells. Turns out they're actually not useful therapeutically. We're talking about adult stem cells. This means anything from the time you're born forward, the cells that are in your body that have these characteristics that we're going to talk about. Embryonic stem cells come from an embryo. The problem with them is they can be and are a cancerous type cell. So if you take them out of an embryo and you stick them in an adult, one of us is a patient, they don't know what to do. They're meant to make a whole organism, not to do repair. They're really today not used at all for medical treatments. They're being used in research, and they're an interesting research tool. But because of these problems, they're not being used for any kind of treatments or therapies at the moment. Adult stem cells, on the other hand, are found in all vascular tissues. They can turn into many cell types. They can self-renew, meaning they can duplicate. So now you have two cells that were like the first one, so they can self-renew, so you have more. They truly show the most benefit in clinical trials, so looking at all the data, and they promote regeneration and healing. So they stimulate that. Again, I said they're every place in the body. These are the sources that actually are reasonable to get access to. Like we could biopsy Dr. Rogers' heart or his lung or his brain, and there would be lots of tissue, lots of stem cells there, but it's not really a very good thing to biopsy. So these really, we're using them from mostly from fat, sometimes from bone marrow, and there is some work going on with donor tissues. This is your body's first aid kit. If you cut your finger, if you bruise a foot, if you fracture a bone, this is how your body fixes itself, sometimes with medical assistance for that, but it's your body's own first aid kit. It truly is what the body uses to keep you alive and working. So the technology is your stem cells. These are adult stem cells. They can be harvested from your fat, a little small amount of fat. They can be manufactured into your own personalized medicine. And with those, you can repair damaged cartilage, tissues, reduce inflammation, block pain, fight resistant infections. And we'll probably have just a moment or two to talk about a COVID study that Dr. Rogers and I designed and got conducted at UC San Francisco. And maybe last but not least, they really have an impact on boosting and balancing your immune system. So if you think about MS, RA, various kinds of autoimmune diseases, this is how your body helps try to keep that in check and gives us clues as to maybe using them as a medical tool. Now we're going to talk a little bit about arthritis and mobility. Uh, Motion is magic. Motion is life. Dr. Rogers is a physiatrist, physical medicine. Everything he does is tell people to have motion. Motion really helps improve longevity.
Yep.
However, there are literally every organ system of the body, there are now clinical studies going on and using these kinds of adult stem cells. Some things we really know a lot about, some things we know not very much about. And so part of what we do as a company and in our clinical trials is to do appropriate science ourselves and with colleagues to show the real evidence of how these cells work, what the dose is. And we'll talk a little later about veterinary medicine and how that gives us some of the same clues. So is stem cell therapy really possible? Is this the future? Is it long future? It's already a reality in veterinary medicine and has been for more than 20 years. Use in veterinary almost always leads the way to use in humans. At VetStem, our company here in San Diego, we've provided treatments for more than 35,000 animals with diseases and 40 different diseases. For fun, we've also treated 60 different species, and we can talk about that later as well. We have 15 peer-reviewed scientific publications, meaning our peers, other scientists reviewed our papers, and these are now published and out there as part of our evidence. So this is just 3 patients. This is pre and post. So Maggie probably wasn't a very good case. And in fact, at the beginning, we said, I don't think stem cells are really going to help. She had multiple surgeries and she was now not even able to walk. The veterinarian suggested maybe Maggie was at the end of the road, but the owner kept pushing and said, please, we want to give this a try. And so given that this was pretty much a Hail Mary, we gave it a try. Floppy, very different. Now, if anybody's ever had a wiener dog, you know they have back problems. And Floppy, watch, just trying to get up. Floppy really has a pain problem, and you might suspect maybe there was a blown disc, a slip disc, a fracture in the back. Those were checked, and none of those were true. But nonetheless, there was this severe pain and almost inability to walk. And probably 90% of you listening on this webinar today have a dog, cat, or a horse or a bird. And you know, if you listen to the animal, they tell you whether they want to try. Watch Floppy's tail. You know, Floppy's saying, give me something, let me have a try. Malibu, very different kind of case. Malibu was only a few years old, a young shepherd with really bad hip dysplasia and hip arthritis in both hips. Had tried every kind of medication, pain medication, and none really worked. These three dogs only got single time point treatment. So this is Maggie after 30 days. And Maggie got one dose in her elbow area and then an intravenous dose, which also helps. So you could say Maggie's still got some problems, right? This is Maggie at 90 days, no more treatment. And you can see, although her gait, her way of moving is still a little bit off, watch the tail. Maggie now is essentially pain-free, able to walk, and now has got a chance at least some longevity with a lifestyle that is worth living. Now we'll look at Floppy. This was a total surprise. We obviously didn't grow new nerves in 90 days. We didn't completely repair a spinal column. This was severe back pain. Probably, again, 75% of the people listening to this webinar have some degree of back pain. We all have back pain. And Floppy really had a big advantage from the cells. Now, Malibu, remember, both back hips. So those hips are needed in order to be able to push off and do the things that you're seeing in this video. Malibu not only got treated initially and had this benefit at 120 days, but once every year or two, Malibu got to get retreated with cells stored in our bank. And we'll talk a lot today about cell banking, but we were able to store extra cells and grow extra cells for the future. So for 7 years plus, Malibu got to continue to have this benefit of her own cells. So that's VetStem, and that's what we do at VetStem. And again, we've been doing this for over 20 years. In 2018, we decided to form Personalized Stem Cells Inc., and Dr. Rogers joined us immediately, actually before we even wrote up our first clinical study. And so to start off here, I'm going to turn this back over to Dr. Rogers, but if you don't think that these things have the possibility of approval, this is what the global picture looks like. Dr. Rogers?
Yeah, so stem cell therapy requires FDA approval here in the United States. There are 10 approvals outside of the United States, mostly in Asia and some in Europe. And you can see the name of what they call the drug. These are all essentially stem cells. They all have different names. And they're used for a variety of indications. I think this is the most exciting thing about stem cells is there are so many clinical applications worth investigating. The challenge is there are so many medical indications worth investigating.
Yeah,
And so to understand
yeah.
how to use the tool properly is the challenge. This is actually your slide, Bob, but I think what you're saying
Yeah.
here is there's so many possible things that we could look at.
Let's see. I think I'm over 65, so I get to qualify to talk about this slide. So anybody who's over 65 or feels over 65, look at the 10 most common ailments. Every one of these are ones that either we have or we have friends or family that have them. And if you look on the right-hand side, that's the number of clinical trials globally for each of those 10 chronic conditions. There are hundreds and hundreds of trials around the world. We're not the only ones working on these things. We have sort of a unique twist on it that we'll talk about, of using specifically your own cells. Most of these clinical trials, they're trying to use some form of a pharmaceutical grade donor cell. And we'll talk about maybe why that's not necessarily right for you.
Yeah, and when Bob and I first started the company, we reviewed the entire world literature and looked at all the possible areas of study that we could consider. And I think the slide, the data on the right pretty much shows you where we led. Look at how much data there is now. There wasn't this
Okay.
much when we started, but it shows you where there's a lot of good data in the osteoarthritis
Okay.
literature. We'll cover some of that in a minute. Oh, now my computer doesn't want to play nice. Oh, here we
There you
go.
go.
So as Bob said, we started this company, Personalized Stem Cell, which has the goal of obtaining FDA approval for using autologous stem cells, meaning your own stem cells. And as I mentioned, knee osteoarthritis is a very common condition. More than 30 million Americans have it. More than 500 million around the world, extremely common. It's the most common cause of disability in adults worldwide. And as you're probably aware, many people end up needing joint replacement when the disease advances so far that they don't really have any other options. The problem is, the additional problem is that patients also have this increased risk of all-cause mortality. Earlier, Bob said how important it is that we keep moving. Exercise is the most powerful medication that we have, the most powerful therapy we have. Knee osteoarthritis prevents people from maintaining their activity level so that they can prolong their health span and their lifespan. You can see naturally as we age, the prevalence of osteoarthritis increases. And once you hit that Medicare age, you got about a 1 in 3 chance that you're going to have knee osteoarthritis. And notice we keep focusing on the knee. That's where most of the research is. There's other joints in your body that can become involved as well. This is what an X-ray would look like. On the left, you can see the normal X-ray. So you see the thigh bone, the femur, the shin bone, the tibia, the joint space between it. As the cartilage degenerates, as the osteoarthritis progresses, that joint space becomes narrowed. It will affect the bone. You can see the bone is brighter. So I don't know if you can see my cursor, but you can see
Yep.
increased
Yep.
signal in the bone. You see the joint space is narrowed, and that's part of the pain. Part of the pain is the pressure on the bone. Part of the pain is the inflammation in the joint and the instability of the joint. This is what it looks like if you were to look inside. On the left, you can see the normal knee. So now we're looking at the cartilage. This is what articular cartilage looks like. And what do you notice about it? It's white. It doesn't have a lot of blood flow. Matter of fact, it has no blood flow. It gets its nourishment from the fluid that's floating around in the joint. That's synovial fluid that is squishing in and out of the tissue and nourishing the cells in the cartilage. When you have osteoarthritis, there's a dysregulation of that tissue. And so it degenerates and you get exposed bone, which hurts, right? People who've had osteoarthritis know this. When they put pressure on that bone without that cushion, without that cartilage cushion, it's painful. You can see the tissue can become inflamed and irritated. It can cause chronic inflammation, swelling, warmth in the joint. And then oftentimes the meniscus, which is this little piece right here, can tear and degenerate, adding to the problem. So that's osteoarthritis in a nutshell. The way that stem cells, we're using the word stem cells, the technical term we'll call it is an MSC. You see it down here, MSC, for medicinal signaling cell. That cell has many superpowers, one of which is to modulate the immune system. And this is just showing you how we know that by different studies measuring different aspects of inflammation in the knee joint. But it also has this regenerative effect. Chondroprotection is protecting the cartilage, is helping the cartilage to have a more healthy repair mechanism. Cartilage is not static. It's a living tissue, just like every tissue in your body. It just doesn't grow as quickly as most other tissues in your body. But the stem cells secrete molecules that help protect the cartilage, as well as protect the cartilage from dying, anti-apoptosis. So we can get way into the weeds, but in a nutshell, I tell folks, if your lawn's on fire, stem cells will put out the fire, that's the inflammation, and then fertilize the lawn so that it can regenerate that tissue, that cartilage and bone tissue. And this is what it looks like. So this is a study, one of the earlier proof of concept trials done in South Korea, where patients with osteoarthritis had lost significant portions of cartilage such that their bone was exposed. And after a single injection of their own MSCs into the knee joint, a year later, these doctors went back and looked again with a camera, an arthroscope, and showed the regeneration of new cartilage in the joint. So one of the earliest reports showing that these cells have the ability to restore cartilage. In addition, they measured pain and function, and they showed benefits there as well. And now there have been more than 40 placebo-controlled randomized clinical trials around the world showing good evidence for safety as well as effectiveness and efficacy of MSC therapy for knee osteoarthritis. And every week, it seems like there's a new paper coming out. We now have studies that show outcome all the way out to 7 years, showing good benefit in pain and function 7 years after a single treatment. There's some debate about which cell source is best. Dr. Harman told you that he wanted to biopsy my brain or my liver or my heart to get stem cells because the stem cells are found everywhere throughout the body on those small blood vessels. It just so happens that fat is a very rich source of these vessels and these cells. And most of my patients don't mind it if I take a little bit of their fat. So these are studies that are showing that when you compare cells derived from fat tissue versus, say, bone marrow or umbilical cord tissues, that the benefits are, at this point in time, the literature is showing that the benefits are more substantial when you use cells derived from fat tissue. And this is a meta-analysis published last year showing they reviewed a number of these randomized clinical trials. And I just highlighted there that they looked at the studies. 21 of the studies looked at whether or not the patients had a statistically significant improvement in the quality of the cartilage, either on MRI or by biopsy. And 18 of 21 studies showed that there was benefit. So I don't want to hear any more conversation. I've talked to too many doctors over the years saying that stem cells do not regenerate cartilage. It's not true. The data is overwhelmingly positive. This is a 5-year study, interesting study done also in South Korea, where patients had a single injection. And what you're looking at, real briefly, here's the x-ray. That's your thigh bone. That's your shin bone. Here's the MRI. There's your thigh bone. There's your shin bone. There's a little cartilage thinning here, and it gets thicker every year. They did an MRI after the treatment, and they showed increasing thickness about to year 4, and then it sort of plateaued after that. So we do have evidence that the benefits continue for years after a single treatment. So all this data really prompted Bob and I to take a serious look and to submit to FDA to conduct a clinical trial in humans with knee osteoarthritis. And so actually this study is now published. You can find this study online. I'm happy to say it was actually the first in the United States to be an FDA-approved study using MSCs manufactured with this method in the lab. And so after collecting, you see over here, Dr. Rogers has put your fat in a bag, and the lab techs will extract the MSCs, the stem cells, out of the fat and grow them in culture in an FDA-inspected lab to manufacture stem cells. They are then bottled, and this is just highlighting the method. This is our recipe. I'm sorry about the Lucky Charms reference, but it's helpful to understand that when we take out your fat, there's this whole collection of things. It's kind of like Lucky Charms cereal. You've got the milk, the crunchy bits, the marshmallow bits. The lab will then process the fat such that we can just concentrate the marshmallow bits and then pull out these blue diamonds. These are what I'm calling the MSCs. Those MSCs are then grown in culture in a petri dish so that we can increase their number, because there's good evidence that more is better. So we can get hundreds of millions of stem cells from a single fat collection. That's the technology. The cells are bottled and then frozen in this little pharmaceutical grade bottle. These are what we call culture expanded autologous stem cells. So they are your own stem cells. They've just been grown so that you have, many millions of them. The nice thing that I like as a doctor is I know the dose. I know what I'm giving my patient. I know that it's been tested for quality, potency, and purity. And I know that this is a sterile product. These cells are tested for sterility, so we don't have to worry about what we've heard out of Mexico and other parts of the world where patients are getting bacterial infections and other complications because they were not manufactured in an FDA-inspected facility. This is what it looks like. So the cells, after they've been grown in culture and bottled, they come frozen. We will set the vial. It's really simple technology. This is what VetStem has perfected. So you have a small vial. In that vial are about 15 million of these MSCs. I just simply draw it up in a needle. I use ultrasound guidance to place the cells into the joint. We numbed it first so the patient doesn't feel it. Here you can see the needle going into the joint and then a Band-Aid. So no joint replacement required, just a simple injection into the knee. And these patients can get years of relief from that simple treatment. We have studied our data. This is the data that was published in that study that I showed you. And basically 3 out of 4 patients were significantly improved at 3 months. So this is their baseline. So for example, let's look at pain. We looked at many things. We looked at their activities of daily living. We looked at their pain level. We looked at their symptoms like stiffness. We looked at how active they were in sports and their overall quality of life. So if you look at pain, for example, their scores were low, meaning they had lots of pain. And at 3 months, you see this increase. And that is more or less maintained out to 2.5-year follow-up without any additional treatment. Satisfaction naturally was also very high, 77% patients satisfied with the treatment. And many of these patients had been told they needed joint replacement for their knee osteoarthritis. Most of these patients were in the severe category and were told they needed joint replacement, but almost 80% of them were able to avoid joint replacement 2.5 years later. We're still tracking them. The patients who ended up getting joint replacement told us at 1 year they were satisfied with their treatment. Unfortunately, because of the restrictions of the study that we were running, they couldn't get a repeat dose. It was not part of our protocol. And so many of them told me they would have rather had a repeat injection, but instead had to go on and have surgery. So we think repeat treatments will be a big part of the protocol going forward. So we have this program called STEM Ensure. STEM Ensure is our stem cell banking program. Again, this is what was perfected by VetStem, where after a simple liposuction procedure, you can have a pharmaceutical grade product manufactured in the lab, 15 million cells per vial, which is enough for a knee joint. This is stored in the cryopreservation, and it's a licensed tissue bank. The nice thing is these cells they don't age. They're frozen. They're in their hibernation. So when you need them years later, they're still young. We get older, they don't. And this will allow for virtually unlimited number of treatments in the future because you can always grow more cells from that collection. And there's essentially 2 options to consider. One is stem preserve. This is sort of the easy way to get your cells banked now. So I would do a liposuction procedure, done in the office, very simple, and the cells are then banked. If we go beyond and do the 8-stage processing technique where you actually are now manufacturing cultured expanded stem cells in a vial, that's called our STEM Ready program. And those cells are now ready to be used on demand. So God forbid you have a heart attack, a stroke, something. If your physician believes that stem cells might be helpful for you, they're available, ready to go. That's why it's called STEM Ready. So why do people store their cells now? Well, as I mentioned, we're not getting older, Bob. I mean, we're not getting younger. So Bob and I have stored
No,
our
I've had
cells.
my stem cells, so I am getting
Yeah.
younger, in fact.
Yeah. Your
Thank
cells and
you.
my cells are right next to the cheetahs and the rhinos and the elephants. I encourage them to store with. I've had a few patients who thought about it, and then they waited, and then they have health issues that preclude them from going through the process. So it's best to do it now while things are good. There will be future breakthroughs, maybe not from our company, but from others, where those cells might be used in a way different than we're thinking now. And those cells will be available if they're stored now. There are some early access programs that we can talk about for debilitating conditions. And the best way to think about this whole program is similar to what you might do for your child or a grandchild, where you've banked their umbilical cord blood cells. It's the same cells, the MSC cell. It's just that when I was a kid, we didn't have the option. So, but now we do. So we stored my fat-derived MSCs. We have these early access programs. So I told you the FDA considers your cells to be a drug. We can debate whether or not that's right thinking or not. but when they are manufactured in the lab, they do require FDA approval. However, there are these early access programs. Many of you may be familiar with compassionate use or expanded access. So if you have a drug that has been studied in a phase 1 safety study, such as we have done, then a physician can make the argument to the FDA that you could be treated with these cells, and that's an option. For patients who have more severe debilitating conditions, there's the Federal Right to Try Act, which I've summarized here. And this is basically a law that was passed by Congress in 2018, signed into law by the president at that time, which empowers patients to have access to eligible drugs that are not yet FDA approved, but have gone through a phase 1 safety study, such as ours. By the way, we're not the only group that has done safety studies using your own stem cells. There are dozens and dozens and dozens of studies around the world showing excellent safety for a wide variety of indications, not just knee osteoarthritis. Makes sense, right? It's your own cells. But this, we do report to the FDA every year, patients that we were treating. These patients must have a life-threatening or severely debilitating disease. So if they have severe knee osteoarthritis, shoulder osteoarthritis, they may be a candidate for this Right to Try program after they have exhausted standard treatment options and not a candidate for any other clinical trials that may be ongoing at the time. And so this is not under the FDA, although we do report to the FDA annually. This does not require FDA approval to be involved in this program. Okay, so in summary, because I want to get to your questions, stem cell therapy is really not a thing of the future. It's actually happening now. It's actually been happening for a long time. It's already been proven by VetStem in veterinary medicine. You saw the videos. There is an opportunity now to bank your cells now. I encourage everybody to do so. There are early access programs for patients who need treatment now if they qualify. And eventually we will obtain FDA approval. Obviously, our company hopes to be the first in the US to obtain FDA approval to use this for many indications and for all Americans. So the holidays are here. Dr. Harman sent me an email 10 minutes before we went live with this talk. And basically, I like this slide, so I included it. But basically, it's promoting our STEM Ensure program. We believe strongly, like I told you, Bob and I have banked ourselves, our spouses have, our family members have. We strongly believe that this is something that people should consider now. And Bob has generously offered, I didn't even know about this until a little while ago, but you can get free storage of your cells if you make a purchase before the end of the year. So thank you very much for your interest. There's 2 sites you can visit. Personalized Stem Cells is the company that you want to read about, that where this work is being done, the research. And then there's my clinical practice. I put the phone number there if you have a question for me, a medical question, but I would like to get to everybody's questions. Let me stop sharing and pull up the Q&A section.
Yeah, there were a couple of questions, Chris, on the confusion, and this happens often around, are we injecting fat cells? And because we take the cells out of fat, that can be a misconception. These MSCs hide out in the fat. Whoever designed this lovely system that's around our waist that is a storage system for energy, obviously energy, fat goes there, builds there. These cells are around the blood vessels there, and it's easy to get out and super concentrated. But by the time we get done with that 8-step process, these are purified stem cells. There are not fat cells. There's not other kinds of adult cells. There's no contaminating fibrous tissue. This is a purified pharmaceutical cell for sure. And again, it's an adult stem cell, not embryonic.
Yeah, that's why I gave you the Lucky Charms analogy. It's not the bowl of Lucky Charms. We
Yeah.
get rid of the milk, the crunchy bits, and all the other marshmallow bits. We just keep the blue diamonds. That's the MSC. That's the cell that has shown these beneficial effects. So there's going to be some medical questions. By the way, if you have a very personal question, just call me or email me. I'll be happy to answer your personal question, but I'm going to answer some of these questions that are less personal. Someone has a question about gout. Gout, of course, is a condition where you have elevated uric acid levels. It's very painful. You get these deposits in the joints. And it's a long question. Let me get, could you provide
Yeah.
insight potential? So, I'm not aware of any current studies that have used these let's just call them stem cells, for gout specifically, but gout is an inflammatory disease. And the single greatest superpower of the stem cell is its ability to modulate inflammation. Think of it like cortisone, but better for you and lasts longer, right? I tell people anything cortisone can do, including graft versus host disease. You may have heard of this. It's actually approved
Yeah.
in Canada to use
Yeah.
stem cells instead of steroids to treat graft versus host disease, where that organ transplant is attacking the person's body through the immune system.
Yeah, and
So
sort of related to that, Chris, we talk about this often. These cells are a cell pharmaceutical factory. They are a very smart cell with biosensors. So if we take this cell out that's stored in your little vial and we put it in your joint and it's got inflammation, that cell turns on its factory and makes anti-inflammatory drugs, just like naproxen and NSAIDs. Your pain, if it's a particular pain problem, it makes a pain drug like morphine with none of the problems of morphine. So it manufactures what it needs when it needs it, and then when it doesn't need it anymore, it stops. It's why it's adaptive. It's so different than taking a pill in a bottle, an injection that really isn't adapting to what's really needed in the body. These cells are super smart cells, way smarter than the scientists so far at figuring out what the problem is and trying to repair it. And they can be used across all different organs. So you don't need a different cell for your meniscus versus a bone repair versus a tendon tear. It's the same cell. It's a multi-purpose cell.
it really is. I mean, the best testimony for this cell is the fact that we are all sitting here today. Without this cell, none of us we would cease to exist, because you're constantly damaging your body, whether it's through the foods you eat or the activities you do or just the general processes that occur in the body. These cells are designed to exert repair mechanisms throughout your entire life. And whether it's by
Yeah,
the secretion of molecules,
yeah,
uh, there's so many interesting molecules we can go down. I mean, so many different interesting
yeah,
mechanisms we can go down the
yeah,
rabbit hole. But these cells
yeah,
actually can walk. If your injury is here and the cell's here, it can literally
yeah.
walk. Doesn't have feet, but it can walk to the site of injury. It's just a very intelligent design.
And,
Somebody
and,
here,
pro- and probably really important to say, although I've talked about all the other places these cells can go and things they can do, today PSC is really an orthopedic company. Although we will be in other areas for sure in the future. For today, we really focus on in our clinical trials and our own personal evidence is in joint disease, tendon, ligament, meniscus, so orthopedic kinds of injuries and tissues that are degrading. And we really focus on that. It is harder to move on into other areas where we don't have that experience base or the clinical studies to help support that. So that's where we're headed, and lots of other companies giving us lots of data in all these areas. But today we really focus on orthopedic injuries.
that's our area of expertise. That's our training.
Yeah,
Um, as wonderful as these cells are, you still have to be a doctor. You still have to make an accurate diagnosis. You still have to understand all the other treatment options that a person may benefit from. So that has to go into the consideration. But the excitement is that these cells have been useful for areas where so many other treatments have failed. And as I showed you in our data, we
yeah,
can even
yeah,
possibly delay or avoid surgery. So
yeah,
yes, there
yeah.
are many possible indications, but we are focusing strictly on
Yeah.
orthopedic, specifically osteoarthritis, tendon injuries. There's a
So
question
so
here.
can I answer the old age one since I'm the old guy on the call?
Yeah, you can see the questions fit.
Yeah, so I obviously the older you get, the fewer stem cells you have. That's why my hair is gone. My scalp actually has low vascular density and low stem cells. So it's slowly and across your body we get stem cell deficient. And it's part of what we do is multiply these and put them where they need to be. In our last study, what was the oldest patient, Chris? I think
And,
90,
yeah,
92.
yeah, 92. That's right.
And we had a
Yeah.
lot of patients that were in their late 70s and early 80s in our formal clinical trial with FDA. And funny enough, these cells sort of hang out in your fat, and they don't age very much if they're located in fat. Your bone marrow, not the case at all. Even the young Dr. Rogers is probably too old to get a bone marrow right now. His adult stem cells in his marrow are mostly gone. By the time you're 50, 60, there really aren't very many. So it's just a great place to get them, and they're still very young. So we don't have an age limit in terms of what we think. We actually published on that in veterinary, 1,000 animals, and from young ages to very old ages, and dogs, cats, and a lot of other species, and their cells still have the ability to multiply and do their medicinal work.
Yeah, you touched on a point that this is a question that I commonly get from patients is how is it possible that my older stem cells could possibly be better than a newborn baby's umbilical cord or the placenta? You know, these cells are found in the
Yeah,
placenta, the umbilical
yeah,
cord, the amniotic fluid. Well, I'm a data guy. If you look at the published papers where stem cells derived from the umbilical cord were used to treat knee osteoarthritis, and you look at the studies where they used a 65 or a 75-year-old patient's own fat derived stem cells, the data is pretty clear. It works better when you use your own cells. Whether
yeah.
that's because it's a donor cell versus your own cell, maybe your body's mechanisms deal better with its own DNA. We don't know yet, but the data is pretty clear, the clinical data. Now, if you look at the petri dish data, you say, oh, the baby stem cells grow faster. That may be true. I don't care about that. I care about clinical outcomes. And, we have patients, like Bob said, that are in their 80s and 90s that are getting good outcomes. And it's not just us doing this research. Others have shown similar benefits in older patients.
And we keep mentioning umbilical cord. Some of you have heard, and there's a question about exosomes. All of these umbilical cord, placental cells, amniotic, they're all different birth tissue kinds of terms. All those in the US, illegal, unknown efficacy, unknown safety, and by companies that are truly doing something that's illegal. And there's also a risk when it comes from some other source other than you. You're going to get somebody else's virus, bacteria, or genetic material. I'm at you, but I have my own cells stored, and I'm not using any unless it was a true emergency and I didn't have my own cells or I couldn't use my own cells. It isn't that those cells don't have some benefit for sure, but before AIDS, we didn't know there was AIDS. Before COVID, we didn't know there was COVID. Before blank, the next virus that's going to show up popping out of like bird flu that ends up in people, the source of those cells puts you at more risk than using your own cells, for sure.
Yeah, as a physician, obviously, I took an oath to do no harm, and we do our best to do no harm. And the way we do that is by offering people products that are safe. And that's my concern. I live near the border, right? Near Tijuana. I've had many, many patients go down to Mexico, and they may be great cells, but they were not manufactured in a lab that was inspected by the FDA. So we're trying desperately to create this technology here in the US to be available. And it's really just a regulatory effort that we need to make. And that's why we need to do these clinical trials. There's just quick note on exosomes, because there's certain things, buzzwords you hear floating around for those of you who are in this space, the longevity, the people that want to do biohacking, the people that are interested in stem cell. You hear about peptides, you hear about exosomes. Just understand that a lot of these technologies are reaching the marketplace way before the scientific evidence is there to show safety and efficacy. The reason why I'm spending my entire professional career studying the mesenchymal stem cell, the MSCs, is because there is such a robust scientific body out there in the published literature. Exosomes, in a nutshell, I tell people your cells don't have a cell phone. So how do your cells talk to each other? They secrete molecules. Sometimes they package those molecules in little bath beads, and those bath beads are called exosomes. But that's not an intelligent thing. Your phone, two people talking on a phone, that's intelligence. Text messages are not necessarily intelligence. So If you look, this translates into the clinical outcome data. Actually, there was just a paper published last month showing that exosomes are not effective for knee osteoarthritis. Obviously, more data needs to be done, more studies need to be done there. But I think, well, it remains to be seen how exosomes compare to stem cells. But Bob really summed it up best. Doesn't matter. In the US, not permitted. FDA prohibits the use of exosomes.
Yeah, and it should be obvious from all of our discussions, we can't do stem cells for everything as a company. It's not legal. It's not a product. It's not out there yet. It's still investigational. But because Congress saw fit to open it with the right to try, a patient who's tried standard therapy didn't work, and they're facing a serious surgery or no treatment for a particular disease, and in our case, we really focus on orthopedics. Then the patient has an option, and your doctor, if it's Dr. Rogers or a different doctor, will advocate, come to us as a company and say, here, this is what we've tried. I'm attesting that this is that we'd really like to try this because we don't have any other good options, and this patient really is affected badly by their condition. And so then we're allowed to do that. That's how we're allowed to get patients treatment before we get an FDA approval. So you can only do that if you've already done the safety testing and you operate under all the FDA's rules. And none of these other companies that are out there hawking all of these things is that true.
I will, so there, we're getting a lot of questions about neurodegenerative diseases, multiple sclerosis, dementia, Parkinson's. Obviously, it's a huge problem in society currently. A lot of research going on, not just in stem cell world, but also in small molecule drug development. I am not a neurologist. I'm not, I'm just going to tell you right now, there's things I know and there's things I do not know. What I can do for you, if you call me or email me, I can help you do the research. You can do some of your own research if you like. There's a website that you pay for with your taxes called pubmed.gov, pubmed.gov. And if you type in your interested subjects, so you say, I'm interested in Parkinson's and stem cells, it'll pull you up all the published research that's going on in that space. That's a great way to find out who the leaders are in the field, who's doing the research, and track down one of those doctors, and maybe they
Well,
can.
and you can also, as Chris and I do frequently, we look at clinicaltrials.gov.
Yes.
That's actually a repository of US and global clinical trials, and you can put in stem cell and your disease, and you can see in what institutions and doctors have open clinical trials. We will have an open clinical trial this next year for single knee arthritis. We've already completed one. We're doing as our process another one. This next year, we may have a clinical trial in traumatic brain injury, which is a horrible disease with no treatments available. So there are ways to access those. And again, Dr. Rogers knows, as do I, a number of the locations around the world where you might go if there's not anything available in the US, but a lot of those are very sketchy. So you really got to know where might be a legitimate place to go if you have a severe need.
Yeah, there's really two parts to the equation. It has to be a good, safe product that's been
Yeah,
tested the way we test it, but also it has to be a doctor who's really practicing medicine within their lane, their scope of
yeah,
training. Don't come see me for your, cardiac bypass surgery. I can't do it. I can't tell you anything
yeah,
intelligent about it. A lot of questions about IV stem cell therapy. Bob, I know you have a lot of expertise in this
yeah,
area in the veterinary medicine,
yeah.
not yet permitted in the US for
Right.
human use, but we have some ideas about how we can do that. But what's your experience in the veterinary space?
Yeah, yeah. First of all, we did an interesting human IV study in COVID with a
Mhm.
partner. So we licensed this to a partner, and that COVID study was run, and it was intravenous administration of cells, one of the first with these kinds of cells for that kind of a disease. And it was effective, but a very small study. In veterinary, we've probably treated now uh, over 10,000 patients intravenously across a number of diseases, but really heavily in the area of orthopedics. So we often will treat with an IV along with a joint injection. We can't do that in human yet. We're working on filing with the FDA, and we hope in 2025 we'll get an approval for a clinical study and see if they accept our COVID data, so that then we'd be allowed to start moving into some more IV administration. We described at the beginning, if you think about these cells, he, Chris said they don't have legs. They actually have little tiny legs, not like we think of them as legs, but they can crawl around. They move around. They also migrate to the bloodstream, stick on the side of vessels, go through tissues. So intravenously means they get to go on the blood highway and go down to areas. They get called to areas of inflammation. So we think the future is we'd really like to be able to do intravenous. So again, I'm not promising, but with my fingers crossed, I hope in 2025 we will have FDA approval to add some intravenous indications to our protocol, because we think that will help, with a number of these cases. But we have to stay as a little company very focused on what we do. So I'm super excited about what that brings to the future. Everybody's thinking about longevity, and hey, I just like to get my IV every 6 months, so that I can stay young. That's not here yet, but the data is starting to become very interesting.
Yeah, if you look at it from a mechanism of
Yeah,
action standpoint, it makes sense. But to
yeah,
my knowledge, we haven't done a study that shows you can double your lifespan. Probably take another 100 years for us to do
yeah,
that study.
yeah,
The the uh the common other common question I get is what's the difference between platelet-rich plasma, PRP, and
yeah,
stem cells?
yeah,
And now, unlike stem cell therapy, which currently is regulated by the FDA, PRP is not regulated by, I'm sorry, by the FDA.
yeah.
PRP is not regulated by the FDA. And that's something that I've been offering patients for over 16 years. I think I was one of the first doctors in San Diego to offer it. It's extremely useful, but mostly for milder conditions. So mild to moderate osteoarthritis of the shoulder or hip or knee, smaller tendon tears is very helpful. Some nerve inflammation is helpful. If you have a herniated disc, something like this, we find it to be very useful. But for these more advanced conditions, the severely debilitating advanced osteoarthritis, then it's not going to be as effective. Fewer people will respond to that treatment, or if they do respond, the benefits won't last years, but maybe only last a few months. So that's where stem cells are more promising.
Also, platelet-rich plasma should never be given in the bloodstream for a systemic disease.
Yeah.
It can make clots, it can cause problems, and platelet-rich plasma is a useful tool. We use a lot in veterinary as well, but it's a one-time deal. It releases its growth factors. It's not adaptive. It doesn't see the environment and say, I'm going to produce these kind of drugs. What's in them is what's in them. It's kind of like giving an injection of a drug. It's a great one, but it's not adaptable and doesn't stay long term and continue to manufacture the drugs that are needed.
Yeah, and that's probably why the stem cells are so much more effective.
Yeah, yeah,
If you were to prick your finger and look in the drop of blood and ask yourself, how old are those platelets in there? They're probably only about 10 days old. Your body's just making them all the time. They only last, a couple weeks at the most, and then they're gone. Whereas the
yeah,
MSCs, the
yeah.
stem cells, they've been with you your whole life.
Yeah.
Uh,
Hey, Chris, could you introduce Corbin? There's a number of questions about the
yes.
program follow-up
Sorry.
and costs sort of in general. And since Corbin's our patient concierge, has a long history with orthopedic clinics and joined PSC this year, 2024, and really has a handle on the patient journey and this and how a patient. So I think you need to introduce him.
Hello,
Yeah.
everyone. It's a pleasure to have you on. You should see in the chat that I put in the website. It's www.personalizedstemcells.com. On that website is where you can get more information that we discussed on this webinar. On top of that, where it says on personalized stem cells, the link in the top is Secure Your Future Health. From there, when you click that, you can actually schedule a 15-minute call with me. I'd be happy to discuss any additional questions about the stem cell banking program. I am not a doctor, so I am not going to discuss medical conditions, but you can get a hold of me really as early as this afternoon at 4:15. And I have time slots tomorrow. You can also download our ebook if you're also interested in that too. So again, www.personalizedstemcells.com. You can look at our cell banking program. And then again, on the Secure Your Future Health, there is a link to my calendar, and that's where you can book a call with me.
And there you can ask questions about what the costs are, but maybe more. This is a new journey for a patient, right? You're going to get a small amount of fat collected, and you're going to get a joint injected, but something that you have not ever done before. Dr. Rogers has been doing this for a decade. I've been doing it 2 decades. It's not that it's a brand new thing, but it certainly will be new for you. And you can get help from Corbin or any of us on what does this journey look like, because it is the future. I saw it 20 years ago. I saw stem cells in a little petri dish turned into heart tissue and a beating heart. And I don't know if you've got that one slide, Chris. We promise at the end of these webinars to also show something really, really novel and new. There's that one picture of the bioprinted cells. If you can throw that up there.
I don't have that slide, but
So I can tell you what's going on now. Truly, you can get your cells 3D bioprinted once this is approved. And the picture was of somebody's ear that was all deformed, and they bioprinted a new ear and implanted it with the patient's own cells. Those are the things that are coming. And Dr. Rogers mentioned new companies. We don't have to discover all these things at PSC. These companies are bringing these technologies to the table, and having your own cells stored for your lifetime means they're available. Even if you get some sickness later that damages your stem cells, you've got your cells that you can then rely on. It's just where the future is going to go.
We live in very exciting times. I'm really fortunate and blessed to be here as this revolution really unfolds. I'm very optimistic that humans will be clever and figure out new ways to use these cells. At the same time, I'm very humble and in awe of this cell that's been around for millions, maybe billions of years, and is pretty damn perfect. I mean, it's amazing how well it works with such limited understanding at this point in time. Really appreciate everybody attending today. Appreciate your excellent questions. Please feel free to email me or call me or text me if you have more questions. Corbin is a wealth of information as well. Please reach out to him. I personally don't think anybody who has fat has a good reason to not bank their fat cells while they're at this current youngest part of your life. You'll never be younger. And anyway, so stay healthy. Have a lovely holiday season. Thank you so much for joining us today. Thank you, Dr. Harman, for joining us today and sharing your experience. And have a great afternoon, everybody.